very important aspect of exercise. There's so many aspects of it that are important, right? But in terms of protecting joints, we know that a strong, flexible muscle mass going across a joint is going to be more protective of that joint. It really, we have lots of evidence for that, lots of research studies that show mechanical pressure going through a joint is going to be better supported by strong muscles, but not just tight, strong muscles. They need to have some flexibility. So that's one component, but also strong muscles have a metabolic response in the body that allow for you to control better maybe some of those inflammatory conditions that are happening. So the general cascade of benefits that you get from muscle strengthening are so many, which again brings us to the bone health. Like strengthening a muscle will create a strong pull on bones, which will help to strengthen bones, right? So so there's so many positive components. Now, which kind of exercise we are talking about, we have to have a conversation with the patients as to what they enjoy doing, what brings them joy, right? So we understand that having some weight-bearing exercise for bones is a very strong indication. But if somebody has a lot of arthritis and pain and they can't do weight-bearing exercise, but we need to work on muscle mass, on keeping those joints strong. So for instance, lower limb joints will usually have more of a problem with weight-bearing exercise. So ankles, knees, hips. But doing something, for instance, along the lines of Pilates or even muscle strengthening that can happen in a different position to help continue building muscle strength and muscle mass.
Some women, maybe they've been runners their whole lives, right? And so all of a sudden they're going through perimenopause and they notice that they're actually getting a lot of these aches and pains. They don't do anything else other than run. And they think that's amazing, but actually they strong on the outside, but their inner core muscles are actually very weak. So introducing other ideas for exercise, like Monica said, Pilates, other low impact exercise that they don't necessarily have to stop the running, but maybe they need to complement the running with some other form of exercise. And it's really interesting that you can have a woman who runs, like she's been doing the same runs every week for years and years and years, and she'll go for a DEXA scan, which is the bone density scan, and she'll still come back as being osteopenic, because for bone density, we actually really need to do specific strength and weight training. It's not enough just to do like running. You have to actually challenge your bones. So it's really looking at a patient and seeing what they're doing, what they're feeling when they're doing that type of exercise, and giving advice as to trying different things.
It's really interesting. There's some research around osteopenia, osteoporosis that shows that long distance running is almost, it's not necessarily as good as, say, sprinting, like sprint running, where you put your system to more of a strain, and jumping even 3 times a week, doing some jumps on the spot with without shoes, so getting a bit of that impact, is actually been shown to be really more beneficial for bone health and bone regeneration than long distance running. So although we do want weight bearing exercise, there are certain simple techniques that you can use, even just heel drop. So if you are standing barefoot and you just,
you can actually feel sort of the reverberations going through the body. That's actually,
and there's been studies showing that that's been very good. So there's lots of different things there that you can do to help with bone health. But in terms of muscle strength, as Tamara was saying, we now really have very good evidence that lifting weights and getting stronger and challenging, straining your body a little bit more can be a better way of building muscle, but protecting joints, improving the metabolism around hormones. So there's so many great benefits to that, and strengthening bones.